by area, so that you can see what needs to be done to contain this. This issue is not now in the hospital, it's out there in the community. So the cooperation of the community is important, the understanding of the community is important, the leadership of the community is important. So that we need to go out there and seek that kind of support. We must therefore continue we must now continue with our monitoring. Part of what we have to do in monitoring is to go and do testing. In some of the areas, particularly these hotspots, we need to now designate areas to get a sense as to what actually is going on. We need then to go into those areas and do community testing. For those, I would like you to design a plan as to where we start, how we start, which areas we're going to focus on and target, so that we can start looking at the extent of the problem in that particular area. I heard that you are busy with a debate on that matter. When we did that before, where we were to screen communities and then do testing, because then you get a better sense as to what is happening. You don't necessarily need to wait for everybody until they come to the hospital. And the reason for it is that a few months ago, or 3 months ago, some study was done on what we call some survey was done on in the Gauteng area, Gauteng province, Sentinel survey, where they took people who came for some different reasons to the hospital, and then they took their specimen and then they actually checked for antibodies. They found that there were more antibodies on the community that had reflected a lower level of positive cases. So, yes, and so in Gauteng, they actually reported about 22% of children under 10 and another 20 about under 19, and beyond that it was about 27 to 30% antibodies. So there's a lot of activity that is going on in terms of COVID-19 infection out in the community. Then we are able to necessarily detect through the positive cases. We also need to increase the testing at the hospital level, so that the numbers of people who are being tested must go up. We have changed the criteria and would like the public hospitals to deal with that situation, increase the numbers of people who are being tested. So the issue of getting that community testing plan, by the end of the week, let's have that plan, and then let's know where we're going to start, and then we look at what lessons we're going to get out of those. That way you will be able to see where we actually end up having to declare that these wards, you've already started seeing here, but it's based on a very passive way of dealing with it, because people go to hospital. But you need to go and check. You need to know in the area, which wards have got more of a problem. So which wards are hotspots, which ones are what? Because then you must try and tailor the behavioral change into those particular wards. That means that we need to be a bit strict on a number of issues. As I said, the issue of super spread events, we should be ready to say that where there are the issues that are exacerbating the spread of the infection, we need to be able to close those down and contain them until we are able to get the situation to come down and move on. So that's the discussion, that's the plan that we must be able to concretize as we move along. I have heard the comment about increasing alcohol-related challenges, motor vehicle accidents and interpersonal trauma and so on. What I'm going to request HOD is that let's get the correct figures on the particular hospitals that are affected and which areas are affected. Because during the surge, we actually had to deal with the restriction of alcohol. It's not something that you just do based on anecdotal stories. You have to be very concrete. Where is it affecting you? Now, once you start having staff fatigue, overcrowding of the casualty areas, all of those issues begin to worry us, and therefore we need to look at what the impact of alcohol is at that level. Let's discuss it once we've got the figures so that we know, is there any need for any specific intervention at that level. So from where we sit now, I think it's important to understand that we need to go and strengthen our intervention more on the socio-behavioral aspect, because that's really where we're going to be able to fight and defeat the infection. And so those are some of the steps that we therefore want to recommend that we take them through. Then there's an issue around isolation and quarantine. We need a stronger campaign in this one, because clearly, if you want to stop a surge, you need to break the cycle by taking people who are infected and their contacts and separate them out into quarantine and isolation until they are free of the virus, and then they can come back to the community. Now this, I've seen the numbers, your uptake is low. That means that we need to go out there and talk to the community, and you'll not convince community unless we actually do so together with the community leadership, wherein we're going to have to go out and support anyone who goes out for quarantine, and we're able to assist those who need to go to isolation and so on. But the issue now is that it needs to be accepted in the community that we need that now, otherwise we're going to have a bigger problem. The numbers of this Nelson Mandela Bay actually does qualify on its own as indicating some kind of resurgence, even though I'm saying it's something that can still be contained. But it qualifies to the extent that we must be able to bring in all the tools that we use to deal with the COVID-19 situation. The numbers of people who are testing positive have increased. Actually, they've increased in such a way that in a day, and I think all of us recall, that there was a time when we had come down to very close to 1,000 positive tests per day, and now we're around 2,000. In fact, for the past few days, we're now shooting above 2,000. Now that number, if you were to split it, very close to 50% of those positive cases are in Eastern Cape. For every 24 hours, very close to 50% are in the Eastern Cape. If you go into the Eastern Cape, of that plus minus 1,000, very close to 50% is Nelson Mandela. Then, of course, comes Sarah Parkman and Buffalo City. Now, Sarah Parkman is interesting as well because of its proximity to the farming areas of the Western Cape. There's a lot of movement there, which in the past did give us the same challenge. And therefore, it's going to require some degree of cooperation on both sides of the provinces to ensure that the farming community cooperates in bringing out the community education for the farm workers, who tend to be the ones who are moving on a seasonal basis between the two provinces. I went to one area where, in fact, in the Ceres Valley, they had actually managed to get, they were the one area that showed up as a hotspot, but with cooperation, they were able to get it contained. And I'm saying Sarah Parkman can actually mobilize those farmers and the farm workers into a point where we can actually start to cut down the numbers. They can actually be decreased with that kind of level of cooperation. At least because there you've got units, people are there working in a farm and they are farming community, so you can actually work with them in a way, because there's some central point where you can actually send information and education can be conducted from there. So I think you should take that one up and pick it up from there. But Buffalo City, we've seen that the numbers are also indicating some kind of bubbling, and therefore we need to now watch on all of them. So what we do now, we do a map and look at the numbers, and you'll see how the migration of the intense red colors are showing how from one area to the other. In some cases they reduce, but in some cases you start seeing a coalition. Nelson Mandela is beginning to be a coalition of high activity of positive cases and increased transmission. So in terms of all the indications of an uptick or an upsurge, you have the positive cases are increasing, hospitalizations numbers are increasing, the positive case rate has increased. When it come down from national level, it come down to about 10% of positive, percentage positive cases. It's gone up to 27%. We were at 27% as a country during the peak in July. So that gives you a sense. And if you look at the Sarah Parkman numbers, they're suggesting that there are more numbers now than you might have seen before. We've looked at a number of countries. We get concerned about how those countries have seen a higher surge than the previous one. Now, we are saying we can try and change this. So, hospitalization numbers have increased, mortality numbers are increasing. So all of these are indicating that we are not dreaming now. We are really facing something that needs to be acted very aggressively. That is therefore the reason why we thought we need to come and join you this morning. We do note the fact that you have had to deal with elective surgery. We're actually been just reintroducing it back so that we can get back the normal services. So we need to keep watching as well that we don't start losing people who are on treatment for other common conditions, your blood pressures, your diabetes, tuberculosis, HIV, and so on. We mustn't lose those as well, falling off. Because when we look around on what we report as excess deaths, it does give an impression that the situation, people may not necessarily die of COVID, but the environment is such that people will be dying of other things that they probably may not have necessarily died of were we not under this pressure of COVID situation. So we need to be therefore aware that of all the cases that we're dealing with, I asked for the numbers from MRC between beginning of the year up to now, how many people had died in the country. They gave me a figure of just under about 450,000. Now, there's a lot more that's going to cause mortality other than COVID. And therefore, it's important for us to remember that whatever we can do, we must keep an eye on the rest of the other issues, because the bulk of the people who are losing, we're losing because they've got not just COVID alone, but they've also got COVID and other comorbidities. Mainly hypertension, heart diseases, diabetes, renal diseases, and then of course TB and HIV and so on, cancers and so on. So we then need to understand that it's a country's response. So whatever happens here, this is where the whole of South Africa is going to focus to give as much support as possible. So work out your plans and start the interventions, and then continue the work that you are doing. And at the end of the week, you'll give us updates so that we can see what is it that we need to give you additional support on, so that we can try and bring this issue towards a closure. There is a matter that I have not addressed yet because I don't think it's appropriate at this point. And that's the issue which is being handled by my colleague on COCTA. It relates to the traditional initiation ceremonies. It's a matter that we have agreed from the side of government that there should be intense engagement between COCTA and various departments with the traditional communities, so that we see how best we can deal with this situation to reduce the numbers of deaths. It's an important issue that we will at some point continue to deal with, and probably we might have more engagements coming back to the province about. We still have a lot of discussion with our colleagues on that matter. It's a very important matter, but it's going to become a bigger issue as we get to the closure of schools and so on. In the meantime, we've also noticed that intense education needs to be directed towards the youth, the students, because the problems we're seeing in the universities, as you are indicating, may get worse when we get out, when the universities are closed and when the schools are closed. It's a lot more difficult to have orderly behavior on the younger people when they are not under the supervision of the teachers and the principals in the schools and the universities. So it's an issue that we need to give attention to as well. So we are therefore saying it's going to be a steep road ahead, but let's try and climb this steep quickly, because if we do so, we might be able to delay the spread of the infection right across the rest of the country. We are concerned about the festive season, that people will be going out there and they'll be doing a number of things, and the behavior at the time is going to lend us liable to super spread events, and those events during the festive season are going to be very problematic. So we would like to ask from the media, let's intensify the messages of wearing of masks, distancing, hand washing, hand sanitizers, and make people understand that this issue of COVID-19 is a reality that can be worsened or can be controlled depending on how we as South Africans behave. And from that point of view, there is no reason for us to understand that we can be saved from the upsurge that is being seen in the US, in Spain, in the UK, in Italy, all over, simply because we're South Africans. The virus doesn't care who we are. It will behave in the same way that it behaves in any other part of the world. But they're already going through a difficult time, which we can see, and before we got our own wave, we already saw that it was difficult in those European countries and in the West. They are there again. That means, are we going to wait until we're in the same situation, or we're going to start acting early to try and avoid it? We said before we want to flatten the curve, still the same issue, but the issue is how do we delay this? Because the issues of vaccines, whilst they are good news in terms of vaccine development time schedules, this is the fastest anyone has ever seen. However, that's not good enough in terms of the timing. So we can't wait for the vaccine. The vaccine will probably be earliest available sometime next year, and even then it's fast enough, it's very fast. But the point is that we need to survive till that point, and the way to do so is to focus on our containment measures. So thank you very much, MEC, for the briefing. Thanks to the Mayor, thanks to the department and the Metro team, and all of you for your briefing. As you know, MEC knows I take daily briefings, so we always want to see what's happening every day. And if there are issues, MEC, HOD, they can call straight and give us whatever support. Let me say thank you as well to WHO for all the support. This plan that we're working on, we've actually built together with the 43-strong team that came from WHO, and we call it Intra-Action. And we've been promoting it for many other countries, because you have to keep assessing as things are happening and try and adapt and move on to a point where we can use our own lessons to try and improve our own conduct in controlling the pandemic. Thank you very much. We'll then move on to the next program. Thank you, MEC.
As the Minister of Health, Dr. Zweli Mkhize, completes his presentation there, we take you on a short break. We'll be back in a moment.